Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
The Mayo Clinic Family Health Book was first published in 1990, and it has become a classic home medical reference, selling more than 1.5 million copies. It's now in its 5th edition, and the first update since 2009 just occurred. The newly revised and illustrated volume offers the latest in medical knowledge and strongly emphasizes self-care.
The Mayo Clinic Family Health Book is based on the expertise of hundreds of Mayo Clinic healthcare providers and the advice that they give their patients every day. Here to discuss is the medical editor of the latest edition of the Mayo Clinic Family Health Book, Dr. Scott Litin. Welcome back to the program, Dr. Litin.
Well, thanks, Tom and Tracy. Happy to be here.
So I knew that you were a highly respected internal medicine specialist, an all-star, and doctor to some stars. How did you ever get involved in editing books?
Well, my entire career as a general internist taking care of patients, I've been involved in caring for patients and teaching patients how to care for themselves. So this seemed like just a natural progression when I had the opportunity to edit actually the last 3 copies of this book.
Oh, you have it. Let's see it. Now, our listeners on the radio
on
obviously
YouTube,
can't hear,
they can
but
see.
the
Yes.
YouTube, they can see it. It's beautiful.
1,391 pages, what we hope to be a one-stop shop for every family. And one of the best parts is my own photograph
Pictures on the
is on the
back.
back,
On the back.
in case you want to see what I look
That
like.
was taken about 20 years ago, it looks like.
What has changed since 2009? Why do we need a 5th edition?
Well, if you think back to 2009, the president was President Bush. Pittsburgh Steelers had won the Super Bowl. Lots has changed, and that's what's changed in our country. When you think about what's changed in medicine, it's exponential. So because of the rapid changes in medicine, we felt it was very important to look at this book chapter by chapter with our wonderful group of expert clinicians at Mayo Clinic who all care for patients, who many do education and research, and they looked at each chapter. We got rid of things that were no longer as relevant, and we added in things that we needed to put in because things had changed.
So how many contributors in that book?
Tom, hundreds.
Yeah. And then what would happen is you would send a particular portion of the book out for editing to someone, and then they would send it back to you, and then you would go through it, and you had the final say.
Yeah, we have a wonderful group of staff writers as well. So we made it a little easier for our editors to just decrease what was no longer relevant, tell us what we needed to put in, then we'd let them look at it, and I'd have the final look.
So give us an example. What's new in this edition?
Well, there's many things new. One of the things is our genomics section about genetics and medicine. I don't know about you all, but I always found this a little confusing because there's genes and there's chromosomes, and we're all more alike than we're different, but we have many differences among our own genetic makeup. And we took a chapter, fully revised it, made it very readable and interesting to page through. And in the future, probably not completely ready for prime time, but in the future, when you and I go to the doctor, or our children go to the doctor, I'm sure that there will be a genetic image, a genetic template, just like we do a photograph of the person in the medical record so we know who they are. And this genetic imprint will help physicians determine what medicines will work, what won't work, what doses work, and heaven forbid if we have some sort of a major issue like a cancer, which drugs are going to cure this cancer and which drugs are not.
I want to ask you about the competition for this book, because there are others out there. I went to Amazon, and what I found out was another highly recommended one is the AMA Family Medical Guide. I want to know why this one's better. And I also realized that one of their other competitors is a book that you edited, and it's called Mayo Clinic A to Z Health Guide.
Okay, well,
And it's get 4.5 stars on Amazon.
yes.
So which one should I buy?
Well, Tom, I think you should buy both of the Mayo Clinic books that I edited. Now, well, let's talk in all seriousness, though. Mayo Clinic, as we know, has a brand that is known across the world. And why is it branded so high? Because it is reliable information, reliable health information that can be trusted. Do any of us go to the internet to look things up? Of course. I do frequently. Who's going to win the Kentucky Derby? I look online to see that. But when you're looking for health information, we can't always trust what we see online, but we can trust something that's branded with Mayo Clinic.
All right, so what's the difference between that book, the Family Health Book, and Mayo Clinic A to Z Health Guide that you also were the medical editor?
The A to Z Health Guide is essentially an abridged edition of, this is 1,391 pages. The other is a little shorter.
And you can get the other one in paperback, and this one only comes in hardcover, right?
Well, for now, yes.
Yeah.
But I want to warn our audience or reassure them that if there is a chapter or two they don't like in this book or they don't find useful, they can eat it because each chapter is 15 grams of fiber and all gluten-free.
Now, we're recording this on a very hot and humid day, and you said you've got some summertime news that we could apply towards our to share with the listeners.
Yeah, there are some interesting things in every chapter of the book. One of them is medical emergencies and first aid. And one of the things that we recommend, because families are out in their cars, they're driving to the beach or to the mountains to camp, every car, every family should have some sort of a first aid kit with them. And you can buy over-the-counter first aid kits, but some of them don't have a few of the things that we recommend. One thing that some people don't think about is we think about painkillers or Tylenol or ibuprofen, but we don't think about an aspirin. And it's always important to have an aspirin or two or three in your emergency kit, because if somebody in your family or another family is suffering chest pain and a possible heart attack, the first aid while waiting for first responders is chewing an aspirin or two. Another thing people sometimes don't think about is a tweezers. A tweezers should be in every first aid kit. Not just to remove slivers, but this is tick season. There's an overwhelming number of ticks. And we show the ticks in our family health book. We show the kind of ticks that could end up harming people. We even show what the deer tick is that carries Lyme disease. But really, to remove a tick, you want to grab by the head where it's attached to the skin and gently pull. My father, when I was a boy, used to take a hot match and put it on the rear end of the tick.
Or the end of a cigarette.
Yes. Yeah. So just think, if somebody held a hot object on our rear end, would we back into it or go forward? So it didn't always work. Tweezers is important.
If you had to pick your favorite part of the book, what would it be?
Well, one of the things that differentiates our book from others is a part that I'm very proud of, and it's making sense of your symptoms. Because when a patient has a symptom, they don't know the diagnosis. No one comes to the doctor saying, I think I'm having acute pancreatitis or my shoulder is separated. They will say, I have pain in my belly, or I have shoulder pain. And we go through in a very organized way every type of symptom, from shortness of breath to pain in the joints, to pain in the abdomen and the like. And we go through all the possibilities and give some key points. So a patient can either be very reassured that what they have doesn't sound at all like what they were worried about, or they can help their physician or their caregiver think, because they put some thought into it, they can help the caregiver come up with a better diagnosis and save a number of tests, make their history much more clear.
All right, Dr. Scott Litin, who is the medical editor and a Mayo Clinic internal medicine specialist. Thanks so much for being with us. So the book, I looked on Amazon. It's so new, it hasn't even been rated yet, but it looks like a 5-star deal to me.
Wherever fine books are sold, you can pick up a copy.
Okay. Thanks so much, Dr. Litin.
Thank you.